today apart from the speakers, okay? So if you have any questions or comments or anything you would like to say, please do use our chat box function. Hopefully everyone can see that on their home screen. So I would urge people, any comments or questions, we'll do our best to get to some of them at the end of the talks today. So I suppose just to also mention, it's our dementia advisor in South Dublin, Jean Scanlon, that will be managing the chat box. So any general queries, she will do her best to answer, and she'll be also putting up relevant contact details throughout. So please do use that function. So on the topic of our speakers today, first of all, we're going to have Joanne Brennan. So Joanne is a dementia advisor who also works in North Dublin, and Joanne is going to give a very brief overview of the Dementia Advisor service. So look, a lot of you here today are already very aware of the service, or hopefully already linked in with the service, but if not, she's kind of going to give an overview of what exactly we do day to day and details of how to link in with the service if it's appropriate for yourself. And our second and main guest speaker today is Regina Laffer. Regina is a clinical nurse specialist with mental health services for the older person, and she's based out of the Ashland Centre in Beaumont Hospital. And I suppose, you know, the topic that Regina is going to cover today is mental health and wellbeing for family carers. And the reason we asked Regina to do the talk today, and most specifically to cover that topic, is, I suppose, our own experience day to day as dementia advisors. I suppose the majority of calls we would receive on a daily basis are from family carers. And what's very apparent in a lot of those calls, although the carers are ringing up looking for information and advice and guidance about how best to look after their loved one with dementia and manage their care needs, often it's neglecting their own care needs, and unintentionally so. So what kind of transpires in a lot of the calls that I would have with family carers day to day is, I suppose, the cost on their mental, emotional, physical and sometimes financial health in caring for a loved one day to day. And I suppose what the last few months, as we all well know, has served to do is probably exacerbate many of those already existing feelings of isolation, depression, anxiety around the caring role. And of course, which we have to mention today, the closure of face-to-face services, particularly the likes of daycare and social clubs, which were a lifeline to so many people with dementia, but also their family carers. Our own research report in the ASI, Caring and Coping with COVID-19, which was launched in July of this year, highlights a lot of the issues for family carers, particularly over the last few months, but that pre-existed COVID, there's no doubt about that. So I suppose we just wanted to shine a bit of a spotlight with our webinar today on the role of the family carer and really highlight a very neglected area. Okay, so I'll hand you over to Joanne now to speak.
Thanks, Million Anna. The Dementia Advisor service is a relatively new service with the Alzheimer's Society. The service was initially introduced by the Society as it identified a gap in post-diagnosis for the person with dementia and their families in receiving timely advice and signposting to practical information regarding their diagnosis. The advisor will provide emotional support in receiving the diagnosis and education in understanding the diagnosis. In the initial contact with a family, the advisor learns about the family's journey to get a clear understanding of the family's needs at that point in time. The advisor will provide information, advice, and assist them in accessing appropriate support at that stage. They will also highlight areas you may also need to consider, such as planning for the future, which can include legal and financial advice. Once you're linked in with a dementia advisor, they remain a named contact for the family in which they can contact at any stage of their journey to access support during that journey. At the minute, there is currently 8 dementia advisors in Ireland, and if you'd like to reconnect or access a dementia advisor in Dublin, our contact details are on screen. Alternatively, if you're outside of Dublin, if you contact our helpline, they will link you in with a dementia advisor or an appropriate staff member who can deal with your query. As dementia advisors, we work in partnership with both the hospital and community multidisciplinary teams. And it's through these positive and effective relationships, it allows us to enhance a care pathway for people with dementia and their families. One of the key resources in the community for us as advisors is the Psychiatry of Old Age. This team provides a specialised and holistic care for people with dementia and their families who have mental health care needs. I'm delighted to introduce Regina Laffer, Clinical Nurse Specialist in Dementia. Regina has worked in various mental health services for 24 years, and Regina is now going to give us a presentation on mental health and well-being for family carers, and I've no doubt it is going to be very practical and useful to you all as family carers. Thanks a million, Regina.
Okay, thank you, Joanne. I just want to share some slides. Okay. Sorry, just have a problem sharing the slides, Maria, if you could share them for me. Share screen isn't working. So just bear with us a second. That's it, and share screen. Okay. What I'm going to talk about today is mental health and wellbeing for family carers. I've been working with people with dementia for the last 11 years, and one of the things when I'm caring for people with dementia is the person that is the carer is as important as the person that I am dealing with that has a diagnosis of dementia. Often people who are the carers, their mental health can be affected, and the topics that I'm going to talk to today, mental health is a very broad subject, and the topics I'm going to talk about today are just a very small part of the overall mental health and well-being of family carers that has been discussed with me by various families. All of us have mental health, all of us, no matter who we are. Like our minds, like our bodies, our minds have to be cared for. Positive mental health is very important when caring. So we hear the word well-being all the time. What is well-being? What is well-being? It's about being happy, it's being comfortable, being content, being satisfied. Well-being is a broad range of things, but in general, it's feeling good in yourselves. But feeling of well-being are fundamental to our overall health of us as carers. Okay, the better another person. That is the key thing today when we're discussing mental health. If the captain of the ship goes down, the ship goes down. So it's the more equipped you are looking after yourself, the more equipped you.
Apologies, I think we have lost Regina there, technical issues, the joys of webinars. So we'll just try to get Regina back now as quickly as we can. Bear with us just a couple of minutes, we're just contacting Regina. Okay, I think, yeah, we're just getting Regina, she's just connecting back to the internet now, so hopefully we'll have her in the next minute or so. Apologies for this, and we'll get things on the road as soon as we can. Regina. I think my colleague's going to ring her again now just to see that she is getting set back up. Oh, it looks good. And again, apologies if this is a bit of an issue today. You know, certainly, and myself and Joanne are here as advisors. We can answer any questions if anything is on anyone's mind that they'd like to ask us about, or in relation to Joanne's talk there, we can certainly answer any questions, but hopefully for the moment we will get Regina back up and running.
I am
there
back.
We go. Good.
Oh, I apologize to everybody that's listening.
Okay. These things happen, the nature of it.
My mental health and my anxiety, I was just dropped. I've been talking, so I probably have to start again because I actually don't know where I was dropped off. I'm not actually going to share the slides, but the slides are going to be put, because I think that's where we got lost, that I was cut off when I tried to share the slides. So I'm just going to talk through the slides. Slides that I am talking through are going to be put up on the Alzheimer's Society website, so you will have access to them. So I'm going to start at the start again. I suppose I'm going to take a deep breath, because I started to panic because I realized there's a lot of people online listening, and I do apologize, and I hope it doesn't happen again. So what is mental health and well-being? From the start, all of us have mental health. All of us, our minds and our bodies. Our minds need to be well looked after as well as our bodies. It's just important. Positive mental health is important when caring. As I said, what I'm going to say again is a lot of carers that I meet, their mental health has been impacted or can be impacted at some stage in the caregiving process. Now, some caregivers can cope quite well, they're quite resilient. And the caregivers that are listening will know how they're resilient and what works for them today. But there's some carers that have found it difficult, and it is important to discuss mental health because it can be affected. Well-being, what I say, well-being is many things. It's about being healthy, happy, feeling good, resilience, coping with day-to-day life. And many things can influence our resilience. I'm going to talk about well-being a little bit on the presentation. But the key message from today's talk is the better you care for yourself, the better equipped you are to care for someone else. So it's so important. As the saying says, and the captain of the ship, if the captain of the ship goes down, the ship goes down. So it's important to keep the captain well. So when you're caregiving, you are the person that is navigating everything, caring, coping, everyday life stressors. So it's so important to look after yourself. I'm going to mention a few of the main things that carers have spoken to me about, and low mood and depression. Low mood can happen in any of us, and it is a natural response to life events and experiences. But with low mood is persistent and it's for periods of long time, then it may be that you're suffering with depression. And it's quite often that caregivers can report that they feel depressed. Now, caring is very rewarding, and a lot of carers feel very are able, and they're quite resilient. But if you're one of those carers that are feeling quite down on yourself, it's important to acknowledge that, touch in with where you are at the moment. Depression is, I'm going to mention one study, and there'll be a link to it as well, is the de-stress study. And the reason why I mention that is it was an Irish study, and it was done on 200 family carers, and it was spousal caregivers. And in that study, the result was 37% of people acknowledged they had significant depressive symptoms, with a further 40% that were referred to symptoms but not significant, but still had symptoms, depressive symptoms. So that is quite a high rate of people in that particular study that referred to having low mood or referred to having depression. If you are feeling at any stage so low, it's important that you do go speak to your GP. There's a lot of helplines that are available as well that you can talk to at any stage of the day, and I have them in the presentation, and you'll see the numbers when it's put up at the end of the talk. And the numbers I'm talking about is available 24/7. There's a text service. You can see it on screen now. The Where helpline. The Samaritans is 24/7, and the new text message helpline, that was launched back in June is 50808. So if you just want to text someone to discuss your mental health, but it is important to check in. If at any stage you feel at a crisis, carers often don't like to reach out, but just it is important. There are on-call doctors after hours, there is emergency services, and there is your local A&E. But I would advise your GP would be a person you have first point of contact if you're feeling low or depressed. GP can refer to several services in the community areas. There's several in different areas. There's different services available. There may be counselling services. There may be the GP may refer to mental health services, which is services like ourselves. So, if someone had significant depression, the significant depression, GP would sometimes try and treat that individual's mental health or refer depression as well. So often I would meet family carers. I hope you can still hear me. My internet connection is going.
Can hear you, Regina. Can you still? Can't see you. You're frozen, but we can hear you.
Yeah,
No. Apologies again for that. Her internet is really wreaking havoc on her today, so apologies again for this. We'll try to get her back as soon as we can. If there's any questions or anything anyone would like to put into the chat box for the moment, and we'll do our best to answer that, and we'll try to get her back as quickly as we can. Seemed to be going too well, probably a little bit too well, but this happened. Sorry about that. Apologies, we're just contacting her now. Gina's just making contact with Regina just to see what the delay is. Hopefully we can get her back up and running. Okay, so there's a question in there maybe while we're waiting for Regina. I might just put that, Joanne, would you be able to take a question there? So we have one of the attendees today saying that she's finding it very difficult to link in with GP as they're overwhelmed with COVID issues. What recourse do I have in this situation?
Well, I suppose it depends on the issue that you're linking in with them for. If it's something very medical and very serious, if you are finding it difficult to link in with the GP, I would tend to tell families to link in with the out of hours service, the DDoC service, because they can generally do home visits, or you can go see them out of hours, and they will also do the.
Oh, I'm here.
They will also refer back into the GP with a report on the treatment and the outcome of that visit to the DDoC as well. So if you're unsure and you can't access the GP, go to the DDoC or outside of hours GP service.
Thanks for that, Joanne. And hopefully we have Regina
I
back.
am back.
And there's a couple other questions there which I will take note of, and we will come back to them at the end.
Okay, apologies. I think my assistive technology is great until it doesn't work. And just to note, this is my first live webinar, so to be dropped a few times, it's hard. So my mental health, it actually brings me on to talk about worry and stress. I'm going to just continue on from where I last spoke to you. I don't know how much you heard, but I think I finished up with low mood and depression and to contact your GP. The only thing that family carers often report is worry, thinking about the future. They're worried about what if. Stress and the impact of caregiving on their stresses, their everyday stresses. And I suppose I mentioned the de-stress study. In the de-stress study, 35% of carers, and that was spousal carers, reported anxiety symptoms. So if stress, worry is impacting so much on your day-to-day, how you're feeling and impacting how you're caregiving, it is important to acknowledge that you could be suffering with anxiety. And again, it's another thing that you can talk to your GP with. Anxiety is a common feeling for everyone at some stage, and it can be a normal response to many stressful situations. It is also a natural or understandable emotional response that can help us prepare for challenges. So I always say there's a positive in anxiety, even though it's something we don't really want, but it can actually motivate us and plan for the future and motivate us to do things. Anxiety can present in many ways. It can be physical, emotional, social, several ways, but certainly physical. If you're feeling physical or emotional anxiety, physical dizziness, feeling aches and pains, eating too much, eating too little, heavy difficulty breathing, it is important to acknowledge if you're feeling anxious. And these are just topics that family carers have discussed with me. So I'm going to go on and talk about practical things to remember when caregiving. Trying to understand the dementia process. Now, I'm talking today about family carers, about your mental health and your well-being, but yet I'm bringing the topic back to the person that you're caring for. And the reason I am doing that is because family carers have told me over and over again that, you know, they have to remind themselves about the dementia process, the changes to the brain. We can't see the changes to the brain. If someone has a stroke, we can actually often see what has happened to them. We can see that they can't use their left hand. We can see that they can't use their left arm. With the brain, we actually can't see what's happening, and often we forget at times that the brain is changing and the process of the brain is changing. And the person that you're caring for, it is progressive, it is going to get worse, and this may impact who you're caring for. And understanding the process has helped many family carers and alleviate some of their stressors, some of the worries, and then address some of the understanding of why situations may occur for them. All these practical things, and we're talking about practical things to remember when caregiving, is know who's who in dementia care. Now, I know Anna had mentioned earlier a lot of the day centres are closed, the social groups are closed, and that would be the first signpost that we would normally signpost people to link in with some kind of group, some kind of social supports. They're not all open due to we're all living within the COVID restrictions, but it is important to link in with what is available, and there is a lot of online groups available, things that you can link in with. If you don't know who your public health nurse is, it is important to know that if you are wanting to access services, there is a public health nurse in all the local health centres throughout Ireland, and they can signpost you in the right direction of services. If you're fortunate to have an Alzheimer's dementia advisor in your area, I certainly think it's very important to link in with a dementia advisor. And your GP can signpost you in directions of what services are available in Ireland, and they are different throughout different parts of Ireland. So it is important to know what's in your area and who to contact in your area. The next thing, that communication in the dementia giving process. A lot of carers have told me when they've changed how they approach someone and in terms of communication, sometimes their stresses and their anxiety has reduced because they've changed the way they approach different situations. So for example, and I'm going to use real examples that caregivers have spoken to me about. So for example, a carer looking after their mum, and the mum in the evening says, I want to go home. That is quite common things that people, I want to go home. Sometimes family carers will say, "Ma'am, you are at home. This is your home," and try to get them to recognize their home. Now, on occasions that will work, but on occasions that will escalate the situation and make the person that you're caring for quite anxious, quite distressed, when you're trying to get them to recognize their home as their own when they don't recognize it. And if they're getting anxious and they're getting distressed, it's an impacting on you, and you're getting anxious and you're getting distressed. So in situations like that, try to reassure, redirect, and distract. So if the person's looking to go home, can you have all photographs there of home? Where was home for that person? Can you have something for that person to do at that time? Some kind of activity. Can you distract them and say, "Let's go make a cup of tea"? Something to redirect, distract, but reassure them that they are safe, to distract their attention from this current situation because they don't recognize their home. Don't argue. So for example, today is Tuesday and they said, "Oh, today's Monday." If they say today's Monday, that's okay. It's not affecting them in any way. It's just don't argue. It only makes the situation worse. And if they say today's Monday, that's fine. A lot of carers have said when they've changed how they approach situations, that they felt that they're less anxious when they are caring for their loved one. Then the importance of maintaining structure and routine for the person you're caring for. If the person you're caring for has a good structure, good routine to the day, and that is very difficult for us to do at the current situation because our old structure, our old routine since March has all gone out. What we used to do, we have to put in a new structure, a new routine. And a lot of the family carers that I have spoken to over the last couple of months since COVID began, is they have a new structure, new routine, whether that be get up in the morning, have their breakfast, ring a family member maybe at 10 o'clock, watch some TV, go for a walk, have their lunch, but they have a structure and routine for themselves and for the person they're caring for. Activities, and engaging the person in activities. So if you have a structured routine, try and have some kind of activity during the day for the person you're caring for. If they feel a sense of purpose, if they feel a sense of well-being in themselves, that is going to impact on your well-being, because maybe you've gone to visit them that day, maybe you've gone and you've gone to visit them, you do an activity with them. Say for example, the gardening, you went to the garden, you did the garden with them, and you left them and they feel a sense, you know, you've left them feeling good. You will leave there with a sense of well-being as well, because you're feeling good about that situation. So it's important that you engage them in activities. Just to note, there is certain different terms you'll hear in dementia, but one of the terms you might hear is sundowning. Sometimes people become more confused and agitated in the evenings, and that is important to recognize if that's happening for the person you're caring for, to understand that it can happen in the process, and the things that you can do to help in that situation, to have a calming environment, possibly reduce stimulation, make sure that the person isn't hungry, isn't thirsty, make sure that they feel reassured, redirected and distracted at all times, in the sense that they're feeling a sense of well-being in themselves. Sunlight, there is some research that says sunlight, natural sunlight can be good, and if there's no natural sunlight, to pull the curtains and turn on the lights so there's light in the situation. But there's loads of things that you can do in terms of sundown, just to be aware of it. If it poses a problem that you are doing everything that you possibly think that you can do, and someone is coming very agitated in the evening, it is important that you speak to your GP about that. Okay, assistive technology I was going to just touch on. There is a lot of assistive technology that can help family within their own homes. It has reduced carers' anxieties. So personal alarms, that people, if they're living on their own, they may wear a personal alarm, and often sons and daughters will tell me that if they know that their mum or their dad is wearing a personal alarm, they feel good going home in the evening. They know that they have a personal alarm. There's an alarm for absolutely everything now, and throughout Ireland there are several assistive technology libraries. So the assistive technology libraries is a very fancy word to say libraries full of objects that can be used for people in their home. So anything from safety to visual aids to prompts. So when I say visual aids, little things, little plaques to give you ideas that you can do within your own home. Turn off the tap, turn off the gas at the front door. I don't think I've been in anybody's house without a visual aid at the front door. If they live alone, have I taken my keys with me? They're the things that the safety and the visual aids that often can reduce family carers' anxieties, because they know they put these strategies in place. When I say visual aids, a lot of people make their own visual aids and they print them out from the internet, and they often print them out, laminate them. Turn off the cooker, turn off the gas, make sure the taps are switched off, often over the bathroom, and the keys, have I got my keys, would be the most common ones that we would see when I'm visiting people in their home. Regular GP contact. Family carers often say that when they talk to their GP about the caregiving situation, that they feel that their anxieties are addressed, and that they feel that they're listened to, and that their emotions are often, sometimes their emotions can be quite high, and that there is someone that they can talk to that understands. So the GP is very important. I never present without mentioning the word delirium. Now, delirium, some of you will know because you have lived through it. Delirium is something that can happen to any of us, but it can be common for people with dementia. And what delirium is usually a medical condition, that can affect the person. So I'm actually going to use a real example of a delirium to explain it. So it's usually a medical condition that affects someone who have a dementia. For example, a lady living on her own, she's visited by her daughter every single evening. Her daughter comes in, often will have a cup of tea with her mum and go home again that night. So her daughter arrives, and this is real, her daughter arrives, her mum doesn't recognize her. Her mum is quite agitated, quite irritated with her, and a little bit aggressive in manner. And she's not able to make a cup of tea. So in that situation, there was a sudden change, a sudden onset of confusion in that situation. So that her daughter brought her to the GP, and in that situation, that lady had a kidney infection. The kidney infection was treated by antibiotics in that situation, and the symptoms were resolved. And that lady went back to her baseline, living on her own. Her daughter continued to visit every evening, and her daughter continued, she would make a cup of tea for her daughter every evening. So it was important to recognize that there was a sudden change in that situation. And understanding delirium can help family carers recognize different situations and what's happening. Now, if a situation and you were to go to visit your mum and they were brought to the GP and there was no indication of a delirium, so, and I'll go through exactly little things to remember when looking for a delirium, and the GP didn't identify any delirium, then it is important then that the GP knows what is going on for the person that you're caring for. Sometimes then people that maybe are irritable and maybe a little bit aggressive, agitated, would be referred to our services, the mental health services for older persons teams throughout the country, and our teams are throughout the whole country in Ireland. Sometimes people with depression, dementia will feel low, or they're quite sleepy in themselves, and that can be an indication of a delirium as well. So it's not always irritability, it can be, they can be low and sleepy and tired, and just to recognize that. So a few things to try and recognize a delirium. How would you recognize it? There's a little thing called pinch me. So Pinchme. So P, what you're looking for is, does the person have pain? Or it's very common post-operative that people have a delirium for any of us. So if they're post-operation, they may get a delirium. IN stands for infection or infarct. So infarct, maybe they have a little stroke. Infection, a lot of infections can be treated and resolved, and the person can go back to their baseline. C, constipation, very important. If a person is constipated, it can affect their mental health. It can affect what you are caring for, who you're caring for. H, hydration, are they drinking enough? They've told you they've had 4 cups of tea today, but have they had 4 cups of tea today? So metabolic, so changes in the body. But the other thing for you to look at is medication. Has there been changes to their medication? Is there a reason for the change in what you see today? And E, electrolytes. So you'll often hear that the GPs are sending someone for their bloods, check their sodium levels or the calcium levels. So the GP would often check that in their bloods. But E also stands for environment. So the environmental factors that might affect someone's, is there too much noise? Is there too much light? Is there too much stimulation? Is there too little stimulation? So what is happening for that person? To look what's happening in the environment for that person. So they're just little tips that family carers have said when they've understood these little tips, that they found that it was just some of their stressors and worries and their anxieties. I'm going on now to talk about self-care and the importance of self-care. So self-care is very important for everybody. And how often do we do it? How often do we look after ourselves? So I'll divide it into 3 sections. Our physical needs. Are we sleeping okay? Are we eating okay? Are we looking after our own needs? Are we going to our hospital appointments? Are we cancelling our hospital appointments because we're caregiving? Are we having our bloods done regularly? Are we putting our needs on the long finger? And from what family carers tell me, yes, a lot of family carers are cancelling their own appointments because they're caring for someone. So it's important that you look after yourself. The emotional needs, recognize your emotional needs. Does people around you know how you are feeling? Families often tend, so if there's husbands and wives listening today, families often tend to think that you're coping really well because that's how you present to them. Do they actually know how you're feeling? And sometimes parents don't like to tell their children how they're feeling, but it is important to address it. It is important to tell them and share it, and often families really do help when they know how you're feeling. And especially emotional needs, if you're feeling low, again, speak with your GP. And then your social needs. Are you maintaining contact, or do you feel isolated? Do you feel lonely? Have you cut off people? And often it's time. Family carers will say it's time. They don't have the time, but you know, can you speak to that neighbour? And since lockdown, a lot of family carers have told me that they've told their neighbours that they're caregiving for someone with dementia, and the neighbours are now checking in with them, which is a positive thing. And neighbours are often asking them, how are you? How is whoever you're caring for? Because they know now. And it is important to try and stay connected. So it's about trying to get the balance of your needs and the person that you're caring for's needs. And that's difficult. Any family carers that are watching that know me, it's something that I keep saying to people, try and get the balance. It's as important that you're looked after as well as the person you're caring for. It's about getting done what needs to be done and caring for yourself. And you are as important as the person you're caring for. So I have some questions, and they'll be on the presentation at the end. Questions to ask yourself for self-care. Do you review your self-care regularly? Do you check in with yourself about your own needs? Do you take time out for yourself every day? Now, a lot of carers will say no to me, and there's some carers that are very good and will take time out every day. And the carers that will take time out to themselves every day will tell you the benefit to taking time out. And what I'm asking you to do is take maybe 5 minutes time out. I know time is very precious, but 5 minutes. And from speaking with other family carers, they will increase that 5 minutes to 10 minutes, 10 minutes to 15 minutes, 15 to 20, and maybe taking time out 20 minutes a couple of times a day. And if you can do that, that is great, because it's important to look after the brain. And we'll talk a little bit more about that in the next few slides. Are you neglecting your self-care, and why? So is there a reason why you're not looking after yourself? Do you not want to ask for help? Do you feel that you can't ask for help? Is there no one you can ask for help? So, you know, if you're feeling like that, you know, there are helplines that you can speak to people on the helplines about how you're feeling. So it is important just to talk. Acknowledge that you have your own needs. And if there are barriers to your self-care, can you do anything about it? Is there a barrier that you can identify and remove that barrier to looking after yourself? And can you make changes? And can you identify changes you can make and supports that you may need? Can you identify that? And if you even can identify one thing, possibly that may help you in your mental health and well-being. I'm going on to talk about well-being. There are many things that influence our well-being. When people feel anxious, they forget about themselves. And a lot of things that can improve our well-being, you're hearing about all the time. But exercise is one of the things can improve your health and well-being. Exercise, it can be in the back garden, up and down the back garden, going for a walk. If you are able to do more physical exercise, that is great. If you're able to go swimming, jogging, whatever, cycling, whatever exercise for you, but physical exercise can improve health and well-being. For anybody, there is, the HSE actually have chair-based exercises for older adults that actually can be done within your home. So if you are a caregiver that, if you're a caregiver, this is something that actually you could do with the person you're caring for, the chair-based exercises. And you can get that on the HSE website, and there's a link at the end to that. Balanced diet, it's really important. If we're not eating properly, if we're missing out our meals, it is going to affect your physical health. If you're not eating properly, then you may not sleep properly. If you're not sleeping properly, that's going to affect your overall mental health and well-being. So eating properly, exercise, and good sleep pattern is so important. Try and take time out. I've already said that in the previous slide, but one of the things, taking time out, if you're working full-time and you're caring, do you take time out in your lunch break? Do you even go for a walk? Do you stop and have your lunch, or are you still eating it at your desk? Little things that you might be able to change in your life. So look at your life and what you can do to change. Be aware of your own emotions. Try to stay connected with someone and talk to someone. Try something new. Now, I think during lockdown, a lot of people tried a lot of new things, from baking to gardening to projects. But if you could try one new thing, and after this presentation today, if I could ask you just do one thing, is try one new thing in the next week, something for you, not for the person you're caring for, but for you. And certainly a lot of carers have told me one of the things that they have been doing, mindfulness coloring, has seemed to be one of the things that carers have told me during lockdown that has been very beneficial to them. And they are doing mindfulness color. They've been doing mindfulness coloring with the person that they're caring for, and they've started to do it themselves. And you can buy mindfulness coloring books in any of the local shops or any of the bigger bookshops. But it's something that carers have told me that they've tried new and it has worked for them. So just one thing new. It could be just, you know, going for a walk that you haven't been doing. You haven't done that for yourself. So just your well-being over the next week. Relaxation. I'm going to take us through a little relaxation exercise at the end, and be more mindful. I'm going to take us through a little mindful exercise as well. So mindfulness is paying attention to the present, and this actually can improve our mental well-being. There's a lot of research to support that. What is relaxation? I'm going to talk about relaxation first. What is relaxation for you? So for everybody, it's something different, but I've just written down a few of the ones that family carers have told me what was relaxation for them. So I've asked them this week what relaxation was for them. And what they've told me is reading a book or reading the newspaper, listening to music, walking, talking to a friend, yoga, meditation, running, swimming, and watching TV. And that is what family carers told me relaxation was for them. And if you can do that, any of these, maybe that will help you relax. But it is important. Relaxation can help our mental well-being. So mindfulness. Okay, mindfulness-based therapies help us focus our thoughts, our feelings, without becoming overwhelmed. They are used to help treat depression, anxiety, and stress. And mindfulness-based stress reduction helps people learn to cope with stress. And I know there's lots of mindfulness groups in loads of different areas and loads of information on mindfulness throughout Ireland. But I'm going to do a brief mindfulness exercise today before we finish up. And I'm going to do a brief breathing exercise today. Just before I do this, I've only touched on a very brief overview of things in terms of mental health. There is lots of information out there for how to look after your mental health, and I think the HSE website has a section, and there's a link to it at the end of my presentation, on your mental health. And it's a very easy site to navigate and to read the information. So I think it is worth to look up the HSE website if you're worried about your mental health. So the brief mindfulness exercise that I'm going to do is, it's called 5, 4, 3, 2, 1. I'm going to start with 5 things that I can see right now, or imagine that I can see right now. So 5 things. Some of you are at home. You can see the table in front of you. You can see your kitchen presses. You can see the handbag sitting on the sofa. You can see the clock on the wall. You can see the TV. So 5 things that you can see right now. 4 things that I can hear right now, or imagine that you can hear. So I'm actually doing this from my kitchen, so I can hear the humming of the fridge. I can hear the ticking of the clock. I actually can hear a breeze at the back door, and I can hear traffic passing my front part of my house. Now, I didn't hear any of that throughout this presentation because I wasn't being mindful. But by being mindful, I can hear it now. 3 things I can touch right now, or imagine I can touch. So my arm is touching the table. My hand is touching the presentation. I'm holding the presentation, and my feet are touching the ground. And when I bring my attention to my feet, they're not relaxed in the ground. So I'm actually just going to relax my feet, and that's very common. We're not relaxed, and only that I'm being mindful. I know when I'm presenting, an anxiety symptom is very common for me. So until I actually brought my attention to my feet there, I didn't realize I actually had them around each other. So I have them flat on the floor now. So 2 things I can smell right now, or imagine I can smell. What can you smell? I wish I could say I could smell flowers or fresh air, but I'm inside and I actually can smell this morning's breakfast, the burnt toast. Can you smell fresh air? Or imagine you can smell the fresh air. And one thing, the last thing, which we went 5, 4, 3, 2, 1. 1 slow, deep breath. And then simply focus on your breathing in the moment now. So 1 slow, deep breath. In through the nose and out through the mouth. Now that just slowed me right down, that brief mindfulness exercise. And I probably should have did that when we lost connection to start me off presenting again, because it slows us right back down. And that's a simple exercise that we can do anywhere, anytime, at any stage of the day. And if we're feeling anxious. So the breathing exercise, life is hectic, but it only takes a few minutes to stop and think for breathing. So what I'm going to ask you to do now is just sit in a very comfortable chair with your eyes closed. And I'm not going to close my eyes for this because I'm going to just be referring to my notes. With your spine reasonably straight, bring your attention to your breathing. Can you feel your chest going in and out? I want you to imagine you have a balloon on your tummy. I want you to breathe in, and that inflates the balloon. Now breathe out, and the balloon deflates. When you're doing this, thoughts are going to come into your mind, but that is okay. Try and go back and think of that balloon. And again, take a deep breath in, the balloon inflates, and breath out, the balloon deflates. While this is happening, notice the sounds and how you're feeling, and bring your attention back to your breathing, because our minds can be racing of what we're going to do next and what's going to happen next. Breathing can help reduce stress, anxiety, and your panic sometimes. So if we're anxious or stressed, we tend to shallow breathe. And when we're relaxed, we do slower and calm breaths. And this can help us feel calmer. So changing how you feel physically can help you feel mentally calmer. Calming the physical effects of anxiety with deep breathing can reduce and relieve some of our anxieties. So deep breathing is one of the simple activities that we can do anywhere. I know some of you still, I can see some of our presenters still have their eyes closed. That is my last. I'm just going on to mention, and I don't know if we're going to be able to put it up today, but there are a lot of family care stories on the Alzheimer's Society website under family carers. And one of the ones that I don't think we're going to be able, I don't know if we're going to be able to play it today, is Robert's story. And he has sort of a nugget of advice for family carers, and he is a family carer. And his advice was to reach out and ask for help. And if you go in after the presentation and look at his story of caregiving, and he talks about his care and his anxieties, then the last 2 minutes of his talk is about what worked for him. So that is the end of my presentation, and I'm so glad we got to it with any more technical difficulties.
Thanks a million, Regina.
Okay.
That was great. Thank you. Feeling very, very relaxed. As you said, my eyes remained closed longer than they should have. So thanks for that. And look, I suppose the broad number of areas you covered within a relatively short presentation, you know, I mean, it just shows the complexity of the illness. You to touch on so many different areas, you know. And so again, they're the complexity of the issues that family members are coming across daily. And I don't know how often myself I question how they are managing that. In itself. So thanks a million for that. That really was so helpful. And I suppose, look, kind of questions and answers wise, there's just one thing I want to put to you. There's no direct answer, I know, for this question, but I might just throw it at yourself and Joanne. It was kind of put in earlier in the presentation from a gentleman who I'm assuming is a family carer. So there's a catch-22 in mental health for carers. Many carers know how to look after their mental health, but the process of caring acts as a direct barrier to the activities they need to do to look after their mental health. So I suppose what he's saying, he's well aware of the things that he needs to do to keep them well, but feels maybe he doesn't have the time or capacity to do them. I assume, Regina, that's something you're coming across every day when you try to educate families about self-care, that they feel
time is generally, when I ask the family care, what did you do for yourself today? The answer often is, I didn't have time to do anything for myself today. And it is, can you do 5 minutes for yourself in your own home? It doesn't have to be, it is about looking after your own mental health well-being. My advice is you start with 5 minutes, but try and build that up to a period of time that you can fit into your normal everyday life, to fit into your lifestyle. And if it is when you're on your way, if that gentleman isn't living with who he's caring for, when he's on his way to the person that he's caring for in the car, can he do some deep breathing and take that 5 minutes, being mindful while he's driving, in terms of, this is my time, this is, you know, I'm thinking about, instead of thinking, often when we're driving, we're thinking we have to collect the groceries, we have to collect the medications, we have to bring them to appointment. But try and, you know, maybe listen to music, do something very simple while you know, to adapt your lifestyle.
Okay, no, that's very good. And I suppose even it's just to reiterate around our role as well, it's that idea, and you said it so much throughout your talk, Regina, about staying connected. And even if like there are limitations in terms of people you can reach out to, you know, or maybe you don't want to, you don't feel comfortable or ready to talk to people in your own life, be it your adult children, whoever that might be, that's where I suppose the role of the dementia advisor can fit in as well. So taking 10-15 minutes to give us a shout of a day, if you feel that might help, just to talk. It doesn't have to be for specific advice or information, but just to talk through what's going on. That's, to talk about
that. Sorry, just that's where it's very important then that they do access supports and services for the person with dementia, because that will allow the main family care then to get that little bit of respite and a little bit of break, headspace for themselves as well during the day. So that's why it's very important to access those supports.
Yeah. Yeah.
One of the there was another question that came in earlier, and I'll just address it. The question was, my dad has Alzheimer's. Increasingly, he does not recognize me. At these times, I am often a stranger to him, especially towards the evening. It seems to increase his anxiety, particularly when I stay overnight to help him with his care and the following day. Any tips on how to help the situation would be greatly appreciated. So just to address that question, some of the things I mentioned in my talk earlier, I suppose communication in certain situations, especially in the evenings, if someone is feeling more confused and they're quite anxious, redirect and distract, reassure. So distract their attention. And when I say distract, can you distract them from, if they're getting confused, why are you in my house? Who are you? I don't need any help. Can you distract them and say, oh, I'm just here to check in, see how things are. Well, we have a cup of tea. I'm after doing something very good for dinner. To redirect their attention to something. Can there be an activity that person can do in the evening? And I find if you find an activity the person can enjoy in the evening, sometimes it's watching TV, sometimes it's listening to music. Sometimes I have lots of people that fold clothes in the evenings, because that's an activity that they feel it's a housework activity, but it's something that feels a sense of purpose, and has taken their attention from their confusion and their anxiety. And it's about reassuring the person that they are okay. And routine can often help with that as well. So to have a very fixed routine in the evenings. But to answer, I do think, and sometimes it can go into the following day. One of the things I would say is, if the person is very confused and so agitated that may become aggressive, and you've tried to redirect them, distract them, reassure them, undertaking an activity, and none of this has worked, do speak with your GP, because there are things that the GP can try, and there are referral processes that the GP can make if necessary. So do speak to your GP if everything that I've said isn't working, and the situation that it just cannot be managed.
Great. That's great. Thanks a million, Regina. So just anybody, I suppose if there's any other questions or things people would like to run by somebody and they don't feel like doing that today, that's absolutely fine. Please do contact our helpline. I know Jean has put the helpline contact details up along the side several times, so do contact the helpline. Also contact the helpline if there's any links maybe that Jean put up to certain services and supports that you didn't get a chance to copy down the details, like the memory technology resource rooms or anything along those lines. Please just contact our helpline, most important, on 1-800-341-341. That's 1-800-341-341. So today's talk has been recorded. Sorry, Regina. Today's talk has been recorded, so it will be available to access at a later point, and I think so many people will. So if there was anyone you know that couldn't make it today that might benefit from looking back over Regina's talk particularly, I think there'll be plenty of people. You can access it on our website or through the Alzheimer's Society YouTube channel as well. So I just want to extend a massive thanks again to everybody who attended today. We had big numbers, so really thank you for that. Thank you for being patient around the technical issues. And thanks a million, especially to Regina and to Maria McInerney as well. She's our information officer and she managed a lot of the technical side of today. So thanks a million for that. Just to mention again, it is World Alzheimer's Month, so there is a number of educational events taking place throughout the month. So again, contact our helpline, look on the website alzheimer.ie for any information on that. And thanks again for attending, and don't hesitate to get in touch.